Welcome back to Calm Mind and Healthy Body, our channel. In today's video, we're diving into a crucial topic affecting millions of people with diabetes: medications that can raise blood sugar levels. While many know how certain foods and lifestyle choices impact our glucose levels, we often overlook medications' role in this equation. It's essential to understand that various prescriptions, from steroids to certain antidepressants, can inadvertently cause our blood sugar to spike, complicating diabetes management. This discussion is not just informative, it's eye-opening. Many individuals may be taking medications without realizing their potential side effects on blood sugar. By shedding light on this issue, we aim to empower viewers with knowledge that can lead to better health decisions. Understanding how these medications work and their implications can help you and your healthcare provider make informed choices about your treatment plan. For those managing diabetes, being aware of these medications is vital. It can mean the difference between stable blood sugar levels and unexpected highs that can lead to serious health complications. So, whether you're a patient, a caregiver, or just someone interested in diabetes management, this video will provide valuable insights. Stay tuned as we explore specific medications, their effects on blood sugar, and tips on navigating these challenges effectively. Your health journey is essential. Knowledge is the first step toward better management. Before we dive deep into the main subject, if you enjoy our content, we'd appreciate it if you could subscribe and hit the notification bell. Hence, you'll be updated on health tips, recipes, and wellness inspiration. I appreciate your support. The 9 medications that raise your blood sugar the most. Awareness of specific medications that can elevate glucose levels unexpectedly is crucial when managing blood sugar levels. Let's discuss some of the most common culprits. First on the list are corticosteroids, such as prednisone. These anti-inflammatory drugs can increase insulin resistance, leading to higher blood sugar levels, especially when used long-term. Next, we have certain diuretics, particularly thiazide diuretics like hydrochlorothiazide. While they are often prescribed for high blood pressure, they can also cause elevated blood sugar by reducing the effectiveness of insulin. Another group to consider is beta blockers, commonly used for heart conditions. They can mask the symptoms of low blood sugar and may also contribute to higher glucose levels. Antipsychotic medications, such as olanzapine and clozapine, are also known to impact blood sugar. These drugs can lead to weight gain and insulin resistance, making diabetes management more challenging. Additionally, some medications for HIV, like protease inhibitors, can disrupt glucose metabolism and raise blood sugar levels. It's essential to consult your healthcare provider about any medications you are taking, especially if you have diabetes or are at risk. Understanding how these medications affect your blood sugar can help you make informed decisions about your treatment plan. Always communicate openly with your doctor to ensure your medication regimen supports your overall health and diabetes management. The diabetes secret nobody wants to hear. Regarding diabetes management, some lesser-known facts can significantly impact your health, and today, we're revealing the diabetes secret nobody wants to hear. One crucial aspect often overlooked is the role of stress and sleep in blood sugar regulation. Chronic stress triggers the release of hormones like cortisol, which can lead to increased blood sugar levels. Similarly, inadequate sleep can disrupt insulin sensitivity, making it harder to maintain stable glucose levels. Another misconception is that diabetes management is solely about diet and exercise. While these factors are essential, many people underestimate the importance of mental health and lifestyle choices. For instance, some believe they can eat whatever they want without sugar. This is misleading. Even healthy carbohydrates can still affect blood sugar levels. Additionally, there's a common belief that diabetes is a one-size-fits-all condition. In reality, each person's experience with diabetes is unique, and what works for one individual may not work for another. This highlights the importance of personalized care and ongoing communication with healthcare providers. So, we encourage you to rethink your approach to diabetes management. Consider how stress, sleep, and lifestyle choices affect your overall health. By addressing these factors, you can take a more holistic approach to managing your diabetes, leading to better outcomes and improved quality of life. Remember, knowledge is power. Understanding these hidden aspects can make all the difference. 3 diabetes causes no one tells you about. When it comes to diabetes, many people are aware of the common risk factors like obesity and a sedentary lifestyle. However, there are surprising causes of diabetes that often go overlooked. One such factor is inflammation. Chronic inflammation can lead to insulin resistance, making it difficult for your cells to respond effectively. This can result in elevated blood sugar levels over time. Another overlooked cause is gut health. The gut microbiome is crucial in regulating metabolism and blood sugar levels. An imbalance in gut bacteria can lead to inflammation and insulin resistance, contributing to the development of diabetes. Hormonal imbalances are also significant but frequently ignored. Conditions like polycystic ovary syndrome, PCOS, can disrupt hormone levels, leading to insulin resistance and higher blood sugar levels. So, how can you address these surprising causes? Consider incorporating anti-inflammatory foods like fatty fish, leafy greens, and nuts to combat inflammation. For gut health, focus on probiotics and prebiotics in yogurt, kefir, and fiber-rich foods like fruits and vegetables. Lastly, if you suspect hormonal imbalances, consult a healthcare provider to explore potential treatments or lifestyle changes that can help restore balance. By understanding these lesser-known causes of diabetes, you can take proactive steps to manage your health more effectively. Remember, a holistic approach to diabetes management can lead to better outcomes and improved well-being. How to lower blood sugar effectively? Managing blood sugar levels is essential for overall health, especially for those with diabetes. Fortunately, there are practical strategies you can implement to lower blood sugar effectively. One of the most impactful changes you can make is to adjust your diet. Start by reducing refined sugars and processed carbohydrates, which can cause rapid spikes in blood glucose. Instead, focus on whole foods like vegetables, whole grains, lean proteins, and healthy fats. Incorporating more fiber-rich foods can also help stabilize blood sugar levels. Regular physical activity is another critical component in managing blood sugar. Aim for at least 150 minutes of moderate weekly exercise, such as brisk walking, cycling, or swimming. Exercise helps improve insulin sensitivity, allowing your body to use glucose more effectively. Additionally, take into account the power of stress management techniques. Practices like yoga, meditation, and deep breathing can help lower stress hormones that may contribute to elevated blood sugar. Monitoring your blood sugar levels regularly is crucial for understanding how your body responds to different foods and activities. Keeping a log can help you identify patterns and make informed decisions. Lastly, always consult your healthcare provider for personalized advice and adjustments to your treatment plan. They can provide valuable insights tailored to your specific needs. By combining dietary changes, physical activity, stress management, and regular monitoring, you can take control of your blood sugar levels and improve your overall health. Sugar spikes? Do these 3 things today. If you're experiencing sugar spikes, there are immediate actions you can take to help stabilize your blood sugar levels. First and foremost, drink plenty of water. Staying hydrated is essential for overall health and can help your kidneys flush out excess sugar through urine. Aim for at least 8 glasses a day, and consider drinking a glass of water before meals to help control your appetite and prevent overeating. Next, focus on the composition of your meals. Eating balanced meals with fiber and protein is crucial for maintaining stable blood sugar levels. Fiber slows down the digestion of carbohydrates, leading to a more gradual release of glucose into the bloodstream. Incorporate foods like whole grains, legumes, fruits, and vegetables, along with lean proteins such as chicken, fish, or plant-based options. This combination will keep you full longer and help prevent those sudden spikes in blood sugar. Lastly, take into account the power of mindfulness practices. Stress can significantly impact blood sugar levels, so incorporating techniques like deep breathing, meditation, or even a short walk can help reduce stress and promote relaxation. Taking just a few minutes to center yourself can make a big difference in how your body responds to food and stressors throughout the day. By drinking water, eating balanced meals, and practicing mindfulness, you can take proactive steps to prevent sugar spikes and support your overall health. Number 1 most dangerous blood sugar lie you must know. One of the most pervasive myths about blood sugar management is the belief that all carbohydrates are bad for diabetes. This misconception can lead to unnecessary fear and confusion around food choices. The truth is that carbohydrates are an essential macronutrient that provides energy for our bodies, including the brain. Not all carbs are created equal, and understanding the difference is critical to effective blood sugar management. While it's true that refined carbohydrates, like white bread and sugary snacks, can cause rapid spikes in blood sugar, complex carbohydrates found in whole grains, fruits, and vegetables can be beneficial. These foods are rich in fiber, which slows down digestion and helps regulate blood sugar levels. In fact, including healthy carbohydrates in your diet can provide essential nutrients and promote overall health. Instead of eliminating carbs, focusing on balance and moderation is essential. Pairing carbohydrates with protein and healthy fats can further stabilize blood sugar levels and keep you feeling full longer. We encourage viewers to seek balanced dietary advice tailored to their individual needs. Consulting with a registered dietitian or healthcare provider can help you create a meal plan that includes a variety of foods, ensuring you get the nutrients you need while effectively managing your blood sugar. Remember, knowledge is power, and debunking this myth can lead to a healthier, more balanced approach to eating. We encourage you to take charge of your health by implementing the strategies discussed today. Whether adjusting your diet, staying hydrated, or practicing mindfulness, every small step counts toward better diabetes management. If you found this video helpful, please consider subscribing to our channel for more valuable content on diabetes and health management. Remember to like and share this video with friends and family who may benefit from this information. We can spread awareness and support each other on our health journeys. Thank you for watching, and we look forward to seeing you in our next video.